Allergic rhinitis, also known as pollinosis or hay fever, is a condition affecting the body's immune system. This happens when the immune system becomes hypersensitive and reactive to allergens present in the environment. These allergens that trigger rhinitis include dust or mold, pollen, and pet hair. Other factors that predispose a person to having allergic rhinitis include genetics, environmental exposure, growing up on a farm, and having multiple siblings. Cigarette smoke, wood smoke, fumes, perfumes and colognes, wind, humidity, cold temperature, hairspray, and air pollution also count as external factors leading to allergic rhinitis. According to the American Academy of Allergy, Asthma and Immunology, about 7.8% of people 18 years old and above in the United States have allergic rhinitis. The publication added that in 2010, 11.1 million visits in the physician's offices led to the primary diagnosis of the medical condition. In 2010, 7.5% or 17.6 million adults were diagnosed with allergic rhinitis in the past 12 months, while 9% of 6.6 million children reported allergic rhinitis in the past 12 months. Allergic rhinitis starts with the exposure of the person to the allergens present in the environment, according to Medscape. As these allergens enter the body through the nose and the mouth, the body's immune system is activated through several types of cells, mediators, and cytokines. According to Healthline, the common symptoms of allergic rhinitis include sneezing, runny nose, stuffy nose, coughing, itchy nose, sore throat, dark circles under the eyes, watery and itchy eyes, extremely dry and itchy skin that often blisters, hives or red itchy bumps on the skin, frequent headaches, and excessive feeling of weakness and tiredness. There are specific tests that can be done to detect allergic rhinitis. As per Healthline, a skin prick test is one of the most usual tests. It involves the application of various substances onto the skin to determine the body's reaction to them. The test yields a positive result if a small red bump appears on the skin. Aside from the skin prick test, another common test to check allergy is a blood test called radioiodine test (RAST). The test measures the amount of antibodies called immunoglobulin IgG to specific antigens present in the bloodstream. Lifestyle modification to avoid allergens stands as the best management for allergic rhinitis, according to Medline Plus. While it may be impossible to fully avoid all the triggers, one can do a number of things to limit the exposure from them. These include reducing dust and dust mites in the house, avoiding exposure to plant pollens and animals, controlling molds indoors and out, having furnace filters or other air filters, avoiding certain outdoor tasks, changing where pets eat and sleep, removing carpets and furniture from the floor, and using a dehumidifier to keep the air in the house dry. Medications may be necessary in the management of allergic rhinitis. According to NHS, one may alleviate the symptoms by taking over-the-counter medications like decongestants and non-sedating antihistamines. Decongestants decrease swelling of the blood vessels inside the nose, which helps open up the nasal airway and make breathing easier. On the other hand, antihistamines, such as diphenhydramine, chlorpheniramine, loratadine, and cetirizine, work by altering the reaction of the cells to histamine, a chemical released by the immune system to defend the body's cells against infection. In some cases, the person may be prescribed with stronger medications, such as those that contain corticosteroids. Also known as steroids, corticosteroids are non-inflammatory medications prescribed for a broad spectrum of conditions. In allergic rhinitis, these agents act by reducing inflammation and suppressing the immune system. Overall, avoiding the triggers through lifestyle modifications and working closely with the physician are key actions in the management of allergic rhinitis. Page 2. There are various natural sinus pain remedies that can offer relief. This is regardless whether your symptoms are due to allergies, the common cold, or a sinus infection, sinusitis. Before turning to antibiotics or medicines, try these natural sinus pain remedies to help cure congestion and achiness. Natural remedies for sinusitis. Photocredit herbal supplement resource. What is a sinus infection? According to Dr. Axe, the sinuses, or sinus cavities, are hollow spaces in which air flows through, within your bones surrounding the nose. Sinusitis or sinus infection occurs when your nasal cavities become inflamed and swollen. Normally, your sinuses are filled with air, and when sinuses become blocked and filled with fluid, the bacteria, germs, fungi and viruses can grow, therefore causing an infection. Natural remedies for sinus pain. 1. Garlic. Garlic is known to be one of nature's best antibiotics. Garlic is the best way, not only to naturally treat a sinus infection, but to prevent it in the first place. In a study, participants took either garlic supplements or a placebo for 12 weeks during the cold season, between November and February. The garlic taker participants were less likely to get a cold, and when they get a cold, they recovered faster than the placebo group. While the participants who did not take garlic or the placebo group had a much greater likelihood of contracting more than one cold over the span of 12-week treatment period. The study attributed garlic's ability to prevent the common cold virus to its active component, allicin. For general health promotion for adults, the WHO World Health Organization recommends a daily dose of 25 grams or about 1 clove of fresh garlic, 0.4 to 1.2 grams of dried garlic powder, 300 to 1000 milligrams of garlic extract, 25 milligrams of garlic oil, or other formulations that are equal to 25 milligrams of allicin. 2. Stay hydrated. Staying hydrated helps your body in various ways, and it includes keeping your sinuses moist. Drink water all through the day. Also, stay clear of alcoholic or caffeinated drinks, as these can cause dehydration. Although recommended fluid intake differs from person, an easy guide is to drink at least 8-ounce glasses daily. But how can you tell if you are drinking enough water if the color of your urine is clear? This means you are hydrated. 3. Steam inhalation. You can break up thick mucus with just a few drops of peppermint or eucalyptus oil in hot water. With your face down over the water, put a towel over the back of your head and inhale the steam. This can also work with a few drops of either oil that added to the water in a humidifier. Some of these machines actually have a small tank that is included for just such a thing. 4. Use spices. Spicy foods such as hot peppers, mustard, horseradish, curry and wasabi may help clear sinuses. You can add some hot spices to your dishes to open your nasal passages. 5. Vitamin C. Vitamin C is important to proper function of your immune system. The immune system is the system that helps your body to fight infections and protects your body from getting infections. As an antioxidant, vitamin C helps in guarding your cells from free radical damage. Free radicals are present in things that can commonly contribute to the development of sinus infections such as cigarette smoke and air pollution. The recommended vitamin C intake is 1000 milligrams 3x per day. Read more. 1. 9 immunity-boosting foods to fight colds and flu. 2. How to use lemon juice to ease gout. 3. 7 surprising but effective cold remedies you should try.
Thank you for watching. Don't forget to subscribe to receive new video.